Good afternoon, members of the President's Cabinet, members of Congress, members of the Diplomatic Corps, ladies and gentlemen, welcome to the White House, and good afternoon. We're here today on the eve of World AIDS Day 2009 to commemorate this important day of remembrance and recommitment. We have come a long way in responding to the HIV pandemic, but we have much important work left to do. I'd like to acknowledge some of the key leaders in the audience who we have with us today. First, a champion among all, Congressman Barbara Lee. Where are you? Please, thank you. Congressman Lee is chairman of the Congressional Black Caucus, and she just told me that she flew back from much warmer climates to be with us here today. She has long been a champion for people living with HIV/AIDS. We'd also like to welcome Mayor Adrian Fenty. Where are you, Mayor? Mr. Mayor, please, thank you. Mayor, of course, of our hometown, the District of Columbia. Joining us in the audience is also Gail Smith. Gail is a special assistant to the President and Senior Director for Development and Democracy, who's responsible for global health policy at the National Security Secretariat. Gail, where are you? I know I saw you. The President's commitment to HIV/AIDS is demonstrated by the strong leadership of the team that he has assembled within his administration. And we are so fortunate today to be joined by some of the administration's top leaders in this area on HIV/AIDS. So first, we're going to hear from Secretary Clinton. Then we'll be hearing from Secretary Kathleen Sebelius. She'll be followed by the Ambassador at Large of the Global AIDS Coordinator, Dr. Eric Goolsbee. And I'm also pleased to welcome a special guest here who will be speaking after Dr. Goolsbee, Dr. Ellie Katabera, who is the President-elect of the International AIDS Society. And finally, you'll be hearing from Jeffrey Crowley. Jeffrey is, of course, the Director of the White House Office of National AIDS Policy and a Senior Advisor on Disability Policy, and he'll give the closing remarks today. We have major accomplishments to celebrate, major accomplishments, but we also know that there's much work to be done. The President's commitment to fighting HIV/AIDS is personal. During the course of his career, he has traveled around the country, and he has been touched by so many people across the country who are fighting with HIV/AIDS right now. He has said that we're always, not always very good at talking about HIV, and we have to do a better job of talking about it in our places of worship, throughout our communities, our organizations, our schools, and of course our workplace. My commitment to fighting HIV/AIDS is also very personal. You may have noticed as you arrived in the White House that we have panels that are commemorating AIDS memorials, quilts that are hanging all around the White House, and we also have a large red ribbon displayed at the front of our White House. And I cannot see these without thinking about the people in my own life who have lost their lives as a result of AIDS. I watched my sister-in-law die a tragic death. I saw members of her family and her 5-year-old daughter as we all struggled with her death. I've also had close friends who have either passed away as a result of AIDS or were living with AIDS right now. So it's a very deep and personal commitment for me. We have members of the White House staff who have HIV. And as a black woman, I also have to say that it's heartbreaking to see how many black women are affected by HIV and AIDS. Black women have a 15 times greater chance of being infected than white women. Within the African American community, that accounts for 13% of the population in the United States, almost half of the incidences, 46% of the new infections, are within the African American community. The news about HIV, however, is not all grim. In addition to launching the Global Health Initiative, the President has made a commitment to developing a new national HIV/AIDS strategy. This won't make every problem go away, but it does create a real opportunity to make further strides in our government's efforts to combat HIV/AIDS. One thing we know about President Obama is that he makes his decisions grounded in facts. One of the facts about HIV is that it has always been a disease that disproportionately impacts underserved and disadvantaged communities. In our country, this includes communities of color, gay, bisexual, men, people dealing with addiction, and people who are homeless. In recognition of World AIDS Day World AIDS Day, let's recommit ourselves to increasing awareness about how to prevent the spread of HIV and ensure access for all people living with the disease. With this, I'd like to introduce you to Secretary Clinton. Thank you.
As Valerie Jarrett leaves, I want to thank her for her leadership on this and so many issues here in the White House and in the administration, and for her personal testimony as to the importance of this issue for her, for President Obama, for all of us. We are gathered on the eve of World AIDS Day to renew and recommit ourselves. It is obvious to those sitting in this audience as I look out at you and see people who have been involved in this struggle for a long time, that you know that we have made progress, but we face an unending pandemic, one that spares no one, that unfortunately disproportionately affects the most vulnerable, and which is the defining health challenge of our times. And we have to address it through a series of broad and cross-cutting global partnerships and a whole-of-government approach. And that is exactly what we are attempting to do. We know the ravages and complexities of HIV/AIDS here in our own country, and we know, many of us, what it looks like around the world. But we can take some heart in the progress that has been made over the last 2 decades. Access to antiretroviral treatment in low and middle income countries has risen tenfold in the last 5 years. New HIV infections have fallen by 17% over the last 8 years. And much of that progress has been due to the concerted efforts of the United States government and our partners. I want to applaud President Bush for making a serious commitment to American leadership in combating HIV/AIDS. His administration spearheaded the creation of PEPFAR, the President's Emergency Plan for AIDS Relief. And by supporting its implementation and activities, the United States has made the largest effort in history by any nation to combat a single disease. I remember well, serving as a senator from New York, how there was bipartisan support on behalf of this initiative and the extraordinary commitment of dollars and technical assistance that backed it up. PEPFAR has provided life-saving antiretroviral treatment to over 2 million men, women, and children worldwide. Through partnerships with other governments and NGOs, we've supported care for more than 10 million people, including 4 million orphans and vulnerable children. And PEPFAR's efforts to prevent mother-to-child transmission have helped nearly 240,000 HIV-positive mothers give birth to children who are HIV-free. So it is clear that our nation's investments are having an impact, and President Obama is dedicated to enhancing America's leadership in the fight against global AIDS, with PEPFAR serving as the cornerstone of our global health initiative to promote better and more sustainable health outcomes. Later this week, Ambassador Goosby will present the 5-year strategy for the future of PEPFAR, outlining the important role that PEPFAR will play in transitioning from emergency response to sustainable health systems that help meet the broad medical needs of people with HIV and the communities in which they live. In its next phase, PEPFAR programs will support a comprehensive whole-of-government approach in many countries to increase awareness, reduce stigma, and get services to people at earlier stages. Obviously, our efforts are hampered whenever discrimination or marginalization of certain populations results in less effective outreach and treatment. So we will work not only to ensure access for all who need it, but also to combat discrimination more broadly. We have to stand against any efforts to marginalize and criminalize and penalize members of the LGBT community worldwide. It is an unacceptable step backwards on behalf of human rights, but it is also a step that undermines the effectiveness of efforts to fight the disease worldwide. We will also redouble our efforts to address the needs of women and girls who are disproportionately affected by HIV/AIDS in many parts of the world. Promoting the health of women strengthens families and communities and has positive spillover effects in areas like poverty reduction and education. Since we know the most effective health programs are integrated with functioning local and national governments, we will work with partner governments to assess capacity, identify gaps, and make customized plans to meet each country's needs. Now that means creating more programs like the ones that Ambassador Gooseby and I visited in Africa over the summer. In Angola, for example, our PEPFAR partnership framework supports the country's HIV National Strategic Plan to strengthen the healthcare infrastructure there. We visited a clinic in South Africa, which we co-sponsor with the South African government, and heard from patients who not only receive care but also support as they face the stigma associated with HIV and AIDS. Our investments in PEPFAR, the Global Fund, and overall global health have made a positive difference, and we will continue our support. But we have to do more. We have to make sure that our programs foster conditions that improve people's lives and in turn promote stability, prosperity, and security. In this time of very tight budgets in our own government and our own people suffering from unemployment, from other kinds of cutbacks in services, we have to do more even here at home. We've seen some of the results of the cutbacks that are happening at the state and local level. So while we're talking about our commitment internationally, let's not forget our fellow citizens who are suffering right now. And then we also have to make the case to our fellow citizens that our investment in dealing with the pandemic worldwide is in America's interests. So we are committed to doing so. President Obama is implementing the repeal of the HIV entry ban, a long-standing policy that prevented people living with HIV/AIDS from entering our country. The repeal will take effect early in the new year, and we will be vigorously enforcing it. Today, I am pleased to announce that with the repeal of the ban, the International AIDS Society will hold the 2012 International AIDS Conference in Washington, D.C. This conference will draw together an estimated 30,000 researchers, scientists, policymakers, healthcare providers, activists, and others from around the world. So as we look to 2012, we have to continue to seek a global solution to this global problem. On World AIDS Day, let us renew our commitment to ensuring that those infected and affected by HIV, the woman on treatment who is supporting her family, the child who dropped out of school to care for sick parents, the doctors and nurses without adequate resources, that all those who have joined together to fight this pandemic will someday live in a world where HIV/AIDS can be prevented and treated as a disease of the past. Thank you all very much.
Well, it's my great pleasure to have an opportunity to join Secretary Clinton, not only on the stage today, but more importantly, to work on this important issue nationally and internationally. I think the collaboration and cooperation between the Department of State and the Department of Health and Human Services has never been stronger. And Ambassador Gooseby, thank you so much for your great work, and it's great to have the International Ambassador here in the White House. This really is an example of the kind of collaborative effort that is underway to combat the spread of AIDS and to deal with the pandemic worldwide. We're pleased to join Secretary Clinton in welcoming back the International AIDS Conference to the United States. And I want to also acknowledge that Valerie has already talked about Congresswoman Lee, but without her tireless efforts, this would not be announced today. I reminded her that during my early confirmation visits, the first thing she asked me was, when is that ban going to be lifted? And I reminded her that I was not yet the secretary, but I would be happy, if confirmed, to take it on. The AIDS entry ban, the HIV entry ban, was a policy that tore apart families, kept people from getting tested, forced others to hide their HIV status, and forego life-saving medication. And most of all, it didn't reflect America's leadership in fighting the disease around the world. So it was fulfilling to sign the papers to get rid of the entry ban earlier this year. And that really delivers on a commitment made by President Obama during his campaign for the presidency when he made the case that this ban had to go. So we celebrate on the eve of World AIDS Day this step forward. But we have to acknowledge as we make this step forward that we have a long way to go. You've heard from Secretary Clinton about the great success PEPFAR has had. But we also know there are way too many places where too many people are acquiring HIV and dying too young from this disease. So in PEPFAR's next phase, our challenge will be to build on the successful interagency model we've created under the leadership of Secretary Clinton and Ambassador Goosby. And that means working with partner governments to create the kind of local health infrastructure that we can sustain for health improvements we're aiming for. And as the head of the department that has over 1,000 employees in more than 30 countries working to implement PEPFAR, I can tell you HHS is very excited to take this next step. And I want to acknowledge the fact that we have many department leaders with us today, the head of our Health Resources Services Administration, leadership from the National Institutes of Health, from the Secretary's office and my Assistant Secretary, and they're just representative of the team at HHS, eager to work collaboratively on this challenge. As big as our challenges and opportunities are around the world, we can't forget that there is a lot more work to be done here at home. According to our latest data, more than 56,000 Americans are newly affected with HIV each year. And what's more disturbing is this number isn't going down. If our results aren't changing, then our actions have to change. And that's why this summer, President Obama launched an ambitious campaign to develop a national HIV/AIDS strategy that will reduce the spread of HIV, increase access to care, and improve health outcomes for people living here in the country with HIV, hopefully eliminating HIV-related health disparities right here in the United States. As part of that campaign, the director of our Office of National AIDS Policy, Jeff Crowley, and my department have spent the last few months hosting community meetings around the country to hear from state and local leaders and Americans living with HIV/AIDS about what the components of the new domestic strategy should be. What we know is we need to do a lot better job reaching the groups that have been hardest hit by HIV/AIDS. Here in Washington, D.C., Mr. Mayor, I'm sure you're aware that 1 in 16 African American men are HIV positive. And if you look at just the gay men in the community, the numbers are even more staggering. In 2005, the Centers for Disease Control found that in 5 major cities, almost half of all African American gay men are HIV positive. That's why we recently launched a $45 million HIV education campaign. It's our first federal HIV education campaign in over 20 years, and it's specifically targeted to underserved community including racial minorities, women, gay, and bisexual men. We're also taking steps to make sure that Americans get the care they need. Earlier this year, we reauthorized the Ryan White HIV/AIDS program, which provides life-saving care to the more than 500,000 Americans. And we'll continue to work with Congress to pass health insurance reform that will prevent Americans from being denied coverage because of their HIV status and because they have a cap on their out-of-pocket expenses. This World AIDS Day, we remember those who we've lost. We look back on the lives who have been saved, and we rededicate ourselves to reaching all those affected by HIV/AIDS, not just around the globe, but here in our home communities and in communities across the country. And to talk more about the announcement we're making today, I'd like to introduce a man who's been working to help people with AIDS for as long as we've had a name for the disease, Ambassador Eric Goosby. Ambassador.
Well, thank you. Thank you. It's really an honor to speak to you today. Secretary Clinton, Jeff Crowley, Dr. Ellie Cadabera, and Valerie Jarrett, and thank you, Secretary, for the introduction. I'd like to offer special greetings to the members of the Diplomatic Corps from PEPFAR partner countries who've joined us here today. We're greatly appreciative of their presence, and we value their partnership with us as we look forward to moving ahead together. I see really more people than I can count in the audience who are old friends that we have worked with for many years, going through much of the epidemic. Indeed, the last time we had a international AIDS meeting in the United States was in San Francisco, and it was 1989, so it has been a long time. World AIDS Day evokes memories for many of you, as it certainly does for me, and the urgency around providing prevention care and treatment services is fueled by the memories of those we have lost, so many lives unrealized and potentials unmet. In my first month in this position, I've seen the dedication of those who have made PEPFAR a reality around the world. As those of us who spent time in Africa before and after PEPFAR know, its human impact has been truly profound and continues to reverberate. It's important to acknowledge the work of President George Bush, as Secretary Clinton did, and a bipartisan Congress in creating and continuing to support PEPFAR. The American people can truly be proud of the work that is taking place and of the dedicated people who are doing this work. Yet it is equally true that the global AIDS emergency is far from over. Countries still struggle with vast unmet needs. There are vast unmet needs in our own country. We need to work harder and smarter than ever before, laying a foundation that countries can build on for the long term. Later this week, as Secretary Clinton mentioned, we'll release a new PEPFAR 5-year strategy that reflects what we've learned from the program's first 5 years. It will be followed by the release of annexes providing additional information in more detail on evidence-based prevention, integration of programs, increased capacity building efforts, among other topics. PEPFAR's 5-year strategy will focus on sustainability and sustainable responses, programs that are country-owned and country-driven, programs that address HIV/AIDS in the context of the broader health needs faced by people with HIV, programs that build upon our successes and incorporate efficiencies, programs that work with governments to support policy change to address discrimination, including, as the Secretary noted earlier, the situation in Uganda. It will not be an easy task to transition our emergency response, especially as we maintain high quality of services. But the move towards sustainability is an essential one. As we expand our HIV prevention care and treatment efforts, we need to engage with our fellow international and multilateral partners to create a shared vision of a global response to this global responsibility. I want to offer my thanks to Secretary Sebelius for HHS's important role, as she mentioned, in implementing PEPFAR. Over 1,000 HHS employees dedicated to the implementation and evaluation and improvement of the programs, and for its action to end the entry ban for people living with HIV, a major step. The removal of the entry ban moves us closer to reducing stigma and discrimination associated with the disease worldwide, and is a shining example thereof. Stigma and discrimination against both people living with HIV and most at-risk populations hinder our ability to provide effective prevention, care, and treatment services. It is important for us not only to support service delivery, but also the policies needed to remove barriers to quality and accessible care. As Secretary Clinton also noted, the removal of the entry ban paves the way for the U.S. to host the International AIDS Conference once again in 2012, for the first time since the end of the 1980s. All of us are engaged in this work, domestically or internationally. We rely on new data to deepen our understanding of the science around HIV. The International AIDS Conference is important for generating and disseminating this science. And as program implementers, we look forward to deepening our partnership with the International AIDS Society. I thank you very much for this opportunity. I want to introduce my friend and colleague, Eli Kadabira, who's President-elect of the International AIDS Society.
I am honored to join Secretaries Clinton and Sebelius, Ambassador Guzbe, Valerie Jarrett, and Jeffrey Crowley today. I'm delighted to be here for the announcement that Washington, D.C. will be the site for the 19th International AIDS Conference in 2012. The International AIDS Society is the world's leading independent association of HIV professionals with over 14,000 members from 190 countries. Our core role as International AIDS Society is to convene the biannual international conference. The conference plays a vital role bringing together scientists, community actors, and leaders from all over the world to evaluate the recent developments, to foster debate and dialogue, and to chart course forward to the end of the AIDS pandemic. AIDS 2012 will bring together more than 25,000 people from up to 200 countries in Washington, D.C., a city that is itself deeply impacted by the epidemic. As the President-elect of the International AIDS Society, I'll be very proud to serve as the international co-chair of the AIDS 2012, alongside with my colleague, Dr. Diane Haville, who will be the U.S. co-chair. Dr. Diane Haville is here along with other members of the International AIDS Governing Council, including our current president, Dr. Giulio Montana. IAS Governing Council decided to hold the AIDS 2012 in Washington, D.C., following President Obama's announcement that the United States will end the entry restrictions on people living with HIV. This change is a significant victory for public health and human rights. The IAS now calls on all countries that still have similar policies that restrict free movement of people with HIV and AIDS through their borders to remove them immediately. On the behalf of the International AIDS Society, I express our sincere gratitude for the support the U.S. government and our research and civil society partners have already shown for the conference and its aim. The IAS looks forward to convening the AIDS 2012 in Washington, D.C., and developing ever stronger partnership with all those working in the AIDS, on the AIDS crisis in the United States and throughout the world. Thank you very much.
Good afternoon. I'm Jeffrey Crowley, the Director of the Office of National AIDS Policy. So I want to take one quick note. Valerie acknowledged a couple people at the beginning, and I just want to add one more person. Within the White House, my office has lead responsibility for a domestic HIV/AIDS policy, and she acknowledged Gail Smith in the National Security Secretariat. I also just want to acknowledge Zeke Emanuel, who's also provides important global and domestic leadership on HIV/AIDS issues. So thank you. Since the inception of World AIDS Day in 1988, considerable progress has been made against HIV/AIDS. Our investment in HIV prevention have produced incredible results. In the United States, incidence has fallen from about 130,000 cases a year in the mid-1980s to about 56,000 cases a year currently. Excuse me. Yes, exactly. Our investments in HIV treatments have also borne fruit. In 1988, there were no effective treatments for HIV, while today we have more than 24 treatments that are saving lives and extending lives of people living with HIV. While the development of these medications is important, it's equally important to ensure that they're available to people who need them. That is why the President recently signed bipartisan legislation reauthorizing the Ryan-White HIV/AIDS program, which provides care and treatment to over 500,000 people living with HIV/AIDS in the United States. He's also determined to enact comprehensive health insurance reform that will make insurance coverage more available and secure for all Americans, including people living with HIV. As you've heard from Secretaries Clinton and Sebelius and Ambassador Gooseby, our efforts to combat HIV also extend overseas. With the leadership of former President George W. Bush, members of both parties in Congress, and the American public, including many in our audience today, we have made America the world's leader in fighting the global HIV/AIDS pandemic. The PEPFAR program and other international efforts have given millions of people access to HIV treatment and services where none previously existed. And in May, President Obama announced that his administration will build on these successes by doubling PEPFAR funding over the second 6 years, expanding support for the treatment of neglected tropical diseases, ramping up assistance for maternal and child health, and importantly, integrating these programs in order to better respond to the lives people live and the health challenges they face. Holding the International AIDS Conference in the United States in 2012 will give us an opportunity to reflect on our accomplishments in addressing HIV/AIDS, but also gives us an opportunity to learn from our national and global partners. The President is thrilled that the International AIDS Society will hold its conference in Washington, D.C., and we look forward to working with our local and federal partners to make this conference a success. We have major accomplishments to celebrate, but we also know that much work remains to be done. So as we commemorate World AIDS Day, let's recommit ourselves to increasing awareness about how to prevent the spread of HIV and ensuring access to care for people living with the disease. So this concludes our event. I would like to thank you for joining us, and thank you for your ongoing partnership with us on World AIDS Day and every day of the year. Thank you very much.